So let's break dental disabilities down into two sections. The first will focus on teeth and chewing, and the second will focus on losing jawbone. So first, teeth and chewing. For those of us missing one or a few teeth, I love analogies. So here's an analogy that works. If you were missing a finger or two, life would go on. You could continue to live and work, but you have a disability, meaning you're going to have to modify the way you do certain things, such as holding a pen, such as counting change for coffee at the counter, such as helping your children making arts and crafts. Not that you can't do these things, but you will have to compensate and modify the way you do things, and depending on the activity, you may have a real disability and a resulting inability to carry out this task. Well, it's the same thing with teeth. What do we do with an intact set of teeth? Now, everyone's going to say chew, but even before you chew, you have to greet the world. And your world may start in the morning with greeting a loved one. Whether you like it or not, your teeth will be a part of how you present. You may greet with your teeth in the way of a smile or a scowl. And that depends on many variables. Then you may need to greet someone who calls you dad or mom. Later that day, you may need to greet someone you call boss or someone you call client. The point is, even before you begin using your teeth for chewing, you're using or not using them for presenting your mug to the rest of the world, beginning with those who love you most. So then we get to chewing. Likely 5 to 6 times a day, you're going to put some form of nourishment between your teeth and expect your teeth to grind up that snack or meal so that your body can derive from it some of what you need, vitamins, minerals, and essential nutrients, to not only live but to thrive. If you're missing teeth and you're thinking, I can eat anything I want and I'm doing just fine, if you're saying that, then I have already met you as a patient. You or someone like you has given this reply to me time and time again. And if you're happy with this reply, then I'm happy. This is not a debate, and I'm not trying to convince you of anything. It is actually impossible to convince anyone of anything. It either comes from them or it doesn't. Getting back to, I can eat anything I want. Let me share this with you all. If a person has no teeth at all, not one, can they still eat anything they want? The answer is yes. They can swallow, they can gum it to submission, but they can eat basically anything they want. What's more, they will feel full and even satiated, even blissfully content. So how can that be, considering the certain fact that they had no teeth to chew? The answer lies in stretch. You see, when we pass food into our stomach expands. This stretching sends signals to our brain that, hey, you're getting full. You better finish off your plate and you're done. So eating whatever you want and feeling full after eating, unfortunately, does not mean you actually properly chewed your food, which means you didn't get the nutrients you needed out of it. And it doesn't matter whether that food came from the grocery store, a local organic farm, or your own backyard. 5 to 6 times a day, if you're missing one or more back teeth, you're sending partially chewed food down the stomach where it sits too long because it is not broken down properly. Then it ferments, which means you lose more nutrients, not to mention the gas, which is a normal byproduct of fermentation. If you are missing your upper teeth or missing upper and lower teeth, here are some complications that I can predict that you do not feel right now or know about yet, but certainly are coming your way. Number 1, your jawbone is deteriorating away. We all know about tooth decay. Well, jawbone does also decay or melt away when we lose teeth. What happens to a person's hand when it is put in a cast for 6 months? The bone shrinks drastically. Same with our jawbone when we don't have teeth to stimulate it when we chew. This jawbone deterioration does not hurt though, so we remain unaware of it until it is too late. At some stage, you will not be able to wear your dentures. The foundation of the dentures is the jawbone, and at some stage, there will not be enough jawbone left, to support or hold the denture in place. At that point, serious disabilities set in and a person's ability to eat and digest are seriously affected. Consequently, one's health suffers dramatically. And the third thing you may not be aware of that may be coming down the line is the financial choices you may face with a fixed income. I can relate to you what others have told me later on in life when they come face to face with these disabilities. Unfortunately, many of them are retired at the stage and on a fixed income. This leads to difficult financial choices. They often tell me, "I wish someone had told me this 25 years ago, and I could have addressed this when I was working and had the financial means to do it then." It is not unusual that in the later years of life, when an individual is, say, 80 years old, their children are typically heavily monitoring their finances. It is not unusual that a decision is made to not make a significant investment in getting mom or dad new teeth, given mom or dad's age. It is also not unusual that mom and dad go on to live another decade or more in a state of disability, not being able to chew properly, using another decade or more of denture chemicals and glues to attempt to prevent the dentures from falling out while blowing their own birthday cake, for example. So in summary, there are 3 things that you may not see coming down the road, but that I see every day in my patients' lives that do come down the road as a result of missing teeth. Firstly, jawbone is deteriorating. Secondly, the dentures that may be fitting you today at some stage in the game may not be able to fit you regardless of what dentistry can do for you. And thirdly, you may get to a situation where financial choices become more difficult with a fixed income.